Hello, this is Dr. Peter Swanz with Vital Force Naturopathy and drswanz.com. And I'm going to talk about the COVID vaccine. And the first thing I want to let everyone know is I am vaccine neutral. I am not an anti-vaxxer. I am not an across-the-board pro-vaccine person. I think everybody needs to be able to make educated and informed decisions for themselves and for their families. That is what proactive health is all about. And I am optimistic about the COVID vaccine. I hope that it's safe. I hope that it's effective. And I hope that it is one of the steps we need to take as a society to get back to a more normal way and hopefully better way of living in the future. This vaccine is unprecedented because it is now being distributed under an emergency use authorization. And what that means is the vaccine has not yet been fully tested. The vaccine trials are not completed. They will not be completed for a couple more years. And that leaves a lot of unanswered questions about what it is that the vaccine does. So what I want to share with everyone now is some of the data, some of the numbers that are related to the vaccine, and all of this will be included in the notes here, and this is all from the FDA website. This is from the information that Pfizer had to share with the FDA. The FDA granted the emergency use authorization, and this data is from the studies so far, but it is not necessarily widely known information. And I think as we make informed decisions for ourselves, is this a vaccine something we want to try? We need to be able to make decisions. So I'm going to read some information off of paper because I do not have all of this memorized in my head. The trial was broken down. It was 50.6% male and 49.4% female. Again, this is the Pfizer Vaccine Trial. There were 83.1% white participants, 9.1% black, 28% Hispanic or Latino, 4.3% Asian, and 0.5% American Indian or Native. Right? So that's the breakdown of the 40,000 people in the study that participated in the phase 2-3 study. There were adverse effects from the vaccine, and there's adverse effects when people are given the placebo. So again, these are facts. This is what happened. The adverse effects after the vaccine were significantly more severe and more common after the second dose. So I know a lot of people are in, this week, the next week are heading out to probably get their second dose. And here's some of what you might expect. I'm going to first give statistics for people that were in the 18 to 55-year-old range, and then I'm going to give the statistics for those that were over 55. One really interesting thing about the adverse effects, they were more significant in the younger population, right, and less significant in the older population, which is good news, I think, because it's the older population that's at a greater risk from a COVID infection. And so really that's where I think we should be focusing most of our vaccine efforts. Fever over 100 degrees Fahrenheit. It happened in 15.8% of the vaccine group and 0.5% of the placebo group. For elderly, it was 10.9% versus 0.2% in the placebo group. Fatigue, tired, exhaustion was 59.4% in the vaccine group, 22.8% in the placebo group. In the elderly population, it was 50.5% versus 16.8%. So again, we can see these numbers drop in the elderly, in both categories, the vaccine and the placebo. Headaches happened in 51.7% of the vaccine group, 24.1% of the placebo group. Those dropped to 39% and 13.9% in the elderly. Chills were 35.1% in the vaccine group, 3.8% in the placebo group. These numbers dropped to 22.7% and 2.8% in the placebo group. New or worse muscle pain happened at 37.3% versus 8.2% In the younger population, those dropped to 28.7% and 5.3% in the elderly population. So again, that was new or worse muscle pain, people that already had muscle pain that became worse. New or worse joint pain was 21.9% in the vaccine group compared to 5.2% in the placebo group. In the elderly, that drops to 18.9% and 3.7%. Those requiring or using non-steroidal anti-inflammatory drugs was 45% of the people in the vaccine group compared to 12.6% in the placebo group in the younger population. And those over 55, the numbers dropped to 37.7% and 9.8% in the placebo group. So those were the most common adverse effects, right? We have fever, fatigue, headache, chills, new muscle pain, new or worse joint pain. That's what people experienced. And I think if you've had your second dose of the vaccine and you've experienced any of these, please feel free to share in the comments or just kind of let us know. I'm curious what's happening. For the vaccine group, 21.4% of all the people that received vaccines were equal to or over the age of 65. Only 4.3% in the trials were over or equal to the age of 75. And I just wanted to share that again because we know that the elderly are the most impacted by the COVID infection. So, and I've talked about this already, the reported efficacy of the vaccine and how this was done. I'll refresh everyone real quick about it. 1 week after the second dose of the vaccine or placebo, people were tested, and if they had one symptom and a positive PCR test, they were confirmed with COVID. There were 9 confirmed COVID cases in the vaccine group. There were 169 confirmed COVID cases in the placebo group. The difference there is the 94.6% efficacy that Pfizer has shared, that the news has shared, and that's what allowed for the vaccine to be approved for the emergency use authorization. Now, something that I think is important to understand and to hear about is there was a subset in the Pfizer study that was suspected COVID cases, but unconfirmed. Suspected, but unconfirmed. So again, the confirmed cases, at least one symptom and a positive PCR test. Unconfirmed cases looked like COVID, but were not confirmed. In the study, there were 3,410 suspected but unconfirmed COVID cases. 1,594 suspected but unconfirmed cases happened in the vaccine group. 1,816 suspected but unconfirmed cases of COVID happened in the placebo group. If you take out the cases that happened within 7 days of the injection, because now we're looking at these adverse effects from the injection and thinking those might have looked like a suspected COVID case. So we remove those people. There were 409 of those within the first week in the vaccine group. There were 287 suspected but unconfirmed cases within 1 week of injection in the placebo group. So if we cut all of those out, and now we include the suspected but unconfirmed cases of the COVID vaccine, and we compare the vaccine group to the placebo group, the efficacy drastically decreases from the 94.6% to around 29% effective. That's the difference. So we don't know what was going on yet with these suspected but unconfirmed cases. We don't know yet what the vaccine does in individuals, in individual immunity. How long does it last? Does the vaccine impact transmission? The main information that we know, the main thing that we can take away was it looks like the vaccine is somewhat effective at decreasing cases of COVID in the population that are vaccinated. That range looks to be somewhere around 29% all the way up to 94.6%, depending on how we are counting COVID cases and what we're looking at. So right now, effectively, as more people are getting the vaccine, we're really, in some ways, increasing the testing sample, and a lot of these other questions are going to be answered as we move forward. So I just wanted to share this information. I've been plugging through the information and the data through the FDA website and trying to find what seems interesting and relevant. And I think it's important to be able to make informed decisions as we go forward. So as always, I want to thank you for watching the video, for following me online. You can connect with me on my website, drswanz.com/connect. And please give me some comments, share stories about, whether you've had COVID and recovered, or about your experiences with the vaccine, or your parents' experience with the vaccine. I'm interested to hear what everybody's going through, and I'm grateful for everybody watching and sharing the video. Thanks so much. Peace, health, love, always. Take care.